What is oral hygiene realistically?
Sure. Well, again, the oral cavity is kind of the window to the heart and soul, so to speak. Because everything goes in your mouth, and it goes throughout the system. So it starts there. And if your oral health is poor, oftentimes, there are other health related issues that contribute. The oral health contributes to other things. So if you have those types of things that can lead to diabetic issues and contribute to things. There are certainly heart related issues. There are plaques and bacteria that can be leached off into your system and can contribute to heart issues. So that it's a lot of things involved. It's not necessarily one thing per se, but your overall oral health. If you have good oral health, oftentimes you have good general health. If you have poor oral health, you will often have other health related issues. And one of the things I always wanted to say, James, especially in your health, in your field, being mental health, which is certainly much more prevalent in today's society than it was, when I was coming up as a kid,
Yeah.
and in the past, my parents' era and things like that. Um, is psychosocial aspect. I mean, there's a lot involved in orthodontia especially, but in dentistry in general, as far as the psychological, how you feel about yourself, your self-worth. And if your occlusion or your bite is off, or things are crowded or spacing or whatever, I was teased as a kid, about buck tooth and things like that. And I look back, I kind of shrugged it off, but again, I didn't really know. I came from Germany as a little kid, and spoke German, so as much as English. So there's things that you don't know from when you're coming from different cultures and different things.